The following was recorded at the CCHF Conference 2023 in Cincinnati.
How'd you guys enjoy Brian Stevenson? Yeah, that was intense. That was crazy. It was amazing. This conference has been incredible. We have Cultured Enough has the privilege. I think the door is locked. We had the privilege of working with CCHF for about, I think it's locked, for a couple of years now in partnership with CCHF and Cultured Enough. And what we love about this conference is that because it's all in the health industry and in the medical field, as well as being in communities that are unrepresented or uninsured, it takes out a lot of the guessing of what we're all passionate about and why we're all here. And so I'm from Philly, I'm a straight shooter. So we're gonna get right into it as well, and being able to, I'll play with it. My name is Elisa Vasquez, and definitely being from Philadelphia, I'm still mourning the Super Bowl loss. So I don't know the grieving stages, but I'm in between either denial or anger. I have not accepted it yet. So I'm still going through those phases. So definitely understanding that my upbringing was very multicultural. Grew up in a Black and brown community in North Philadelphia, Hunting Park, as well as the Olney area. And in that, I was a vibrant young girl growing up my mom had a community center, and there was the health center around the corner, and there was a church. Life was good. And what switched for me, and why I'm in the space of diversity, equity, and inclusion, is because transferring from Philadelphia, Black and brown community, went to a predominantly Black school, lived in a Black neighborhood, and then when I went to college, there was a shift. There was a shift from being feeling very comfortable in my space to being in a predominantly white environment. And when I went to American University in DC, all of a sudden this bright young girl who was very vibrant, was very shy, sat in the back, trying to navigate a new space that I was not necessarily prepared to do. And so being able to walk in those spaces in DC, had many jobs in DC. My background is nonprofit management and HR, and also did ministry for about 15 years. And so in each of those spaces, it just happened to be that it was predominantly a white space. And so as a woman of color, you're trying to navigate that space. A lot of things were said, or you hear the side comments, or you don't really feel included, but you're called there. So a lot of those intricacies happened. And in terms of trying to guess or trying to figure it out, I am grateful for the industry and the research behind diversity, equity, inclusion, and belonging, because it gives names and research to those uncomfortable situations. And it is actually tools and resources and empowering to be able to have what are very courageous conversations that we now get to have as well. So in that space, I was able to leave DC, come back to Philly, where I'm a little bit more comfortable, could be a little bit more myself, and to be able to now lead both a consulting company where we do both research data for organizations to get that baseline of where organization is, and then also create professional development sessions for the leadership to be better equipped to manage and run diverse staff. So how many of you are working or involved in a health clinic currently? Okay. How many of you have seen the diversity of patients? Okay. How many of you have seen and been able to experience the diversity of your staff? Okay. How many of you have been able to be led by managers of diverse backgrounds? Okay, that's awesome. How many of you have been able to look at the C-suite and maybe seen yourself represented or seen diversity at the C-suite level of your organization? Fewer hands. And then how many have looked at the board and said, they're a great representation of the community we serve in? As in diversity. Yes, thank you for clarification. That's awesome. That's awesome. Great. I love it. So with each industry that we have worked with throughout the country, we have done about over 150 organizational DEI, DEB audits, been able to speak with CEOs and boards that are trying to get a baseline approach of their organization. And the largest organization that we have worked with is about 4,000 to 5,000 employees across the nation, and working with them nationally to be able to look at both the nonprofit sector, the health sector, as well as the education sector. And I'm gonna be real, the hardest, I'll say hardest. The hardest that we have worked with in terms of developing maybe DEI language or making sure that they define their terminology has been faith-based organizations. And it's because there has been a stigma behind DEI or diversity, equity, inclusion. It's been politicized, it's been stigmatized. And so as a consultant firm, we're able to sit in that because we understand that there tries to be a lot of theology around these concepts at the same time as well. And a couple of the services that we provide are diversity assessments, so looking at organizations. We work with your diversity task force or committees to make sure that they are equipped to be able to carry out organizational change, as well as strategic plans, professional development sessions in terms of psychological safety, emotional intelligence, and cultural intelligence, document support, and then last but not least, also coaching, because we understand that we want leaders that are competent in this work that can lead diverse teams and be able to do that competently as well. I will say that one of our selling points and what has been often asked about or inquired about are white male cohorts, white male learning cohorts. Because we find that what happens is when diversity starts to change within an organization, and when you start to go from learning about each other or having a healthy dialogue, now the next question is, how is DEI embedded into your organization structurally? So a lot of the time, if you were around in 2020, a lot of people were having panels. A lot of people were leaning in to what it looks like to be a person of color, a black individual, the black lived experience in the United States. So a lot of people were in that learning stage, which is great, and it's a good start, and I'm grateful for that. However, what happens when the learning stops and the people who were the change makers in the organization leave? And that's when we talk about structure in the organization as well. So how do we build structure? How do we build a culture of equity and inclusion within your organization is also equipping leadership to be able to lead in that way as well. So we're gonna get into a little bit of what it takes, some of the steps to take for your organization. We have not assessed your organization, so I'm trusting that you're gonna tell the truth, you're gonna be transparent, and you'll be real about where your organization is. In the activity that we have, we want it to be highly engaging, and we actually wanna hear from you. So being able to break up into groups, I would hope that it could be with the people that you work with, but if not, that's okay. But being able to be transparent with where your organization is at in terms of DEI is what the activity is gonna entail today. When you're in your small groups, you could just turn not now, but when you're doing it in small groups, have a posture of listening with one another, understanding, wanting to hear people's experience or perception within their organization. Please be respectful and not interrupt each other. I'm Latina, so we're used to speaking over each other, but definitely be respectful of one another. Disagreement is normal, so I wanna appreciate that. And silence is normal, to give people time to process and to think. So we're okay with that as well in small groups. And then everyone is welcomed and encouraged to participate. So we do want to hear from different people in the room as well. And using I statements goes a long way if you're in a relationship or have a partner. You know that it's what you are going through or what you are feeling that helps with the conversation as well. Share the mic. And I do want to emphasize that I want this space to be a space for learning and asking and making healthy mistakes is what we call. So creating a safe space in this as well. In the surveys that we have done, I will say that in surveying staff in regards to DEI, about 50% are looking for visual role models to represent diversity in leadership. And then also 45% are outreach into more diverse talent pools. So a lot of times the question is, we have diverse patients and we're getting more staff, but what about providers and physicians? How do we diversify and how do we get strategic around that role? And so being able to be strategic about where you recruit, are you going to those diverse talent pools? And being able to also have a culture where if you do recruit diverse talent pools, that you will have a good retention rate. Because a lot of times we like to invite, but we can't retain. So understanding the difference between that as well. If there are any questions, I know this is a large room, but I definitely want to also leave, if you have a question, please raise your hand and we'll address that as well. DEI in healthcare. So a lot of the times what we'll ask organizations to do, and you can notate if you have done this yet, has your organization defined diversity, equity, inclusion, or diversity belonging in your organization? What is it, if I looked on your website, what would it say? And how would it relate to your context? So in terms of diversity, being able to say, understanding the background of your employees and patients being served, including cultural, gender, and sexual orientation, also hiring and retaining a workforce that is representative of the patient population served. This is an example of what diversity could be in terms of being defined in your context. And equity, ensuring healthcare workers have what they need to do their jobs, ensuring that your workforce has what they need to do their jobs. And inclusion, giving employees and patients a voice to help provide and receive high quality care. Giving employees and patients a voice to help provide and receive high quality care. So when you look at your organization and you're able to evaluate it, whose voice is being heard? Do you have organizational staff culture surveys that they're wanting to grasp where the organization is? Are you able to capture that data, both qualitative and quantitative data, to really understand the perception of what the staff are going through as well? I don't think we need to have a conversation, but I will say why this is important. There is data and research that states that when there is increased diversity workforce, it helps reduce the racial and health disparities in that community. Diversity also improves performance. And then also diverse medical teams, this is a study that was found, gave more accurate diagnosis and had higher patient satisfaction as well as saw greater compliance. And a lot of the times we'll look at this, and we've conducted so many focus groups, especially in the faith-based setting, and we'll ask, what is diversity, what is a commitment to diversity in your organization? And we'll receive answers such as, well, we feel that, all this investment or time in diversity is shifting away from our mission, okay? Or we feel that we do really want to have a diverse leadership and we really want to have diverse board, but we want to keep the quality of what we're doing. So you'll really hear the different frameworks and systems as to why what may seem very simple is actually very complex when you bring in different frameworks and different terminology. Any questions or any comments? Definitely want to leave this open for questions and comments. And if you want to interrupt, just please feel free to raise your hand. An example of a study that was done from the National Medical Association. Diversification improves performance, not just by providing a variety of perspectives and skills, but also because diversity facilitates friction that enhances deliberation and upends conformity, which results in better risk assessment. In terms of our activity, I definitely want, we're gonna go through the different stages of where one can be within the organizations in terms of DEI. And with each stage, you will rank it from 5, let's do a tally sheet. 5 being, we've done this, we're actually evaluating every year, we're really good at it. You come and look at what we do in our work, that's a 5. Whereas a 1 is more like, I don't know what you're talking about. And so being able to go through the different stages that we're about to go through, if you need to write it down, and then we'll tally it up. And I'd love to hear where people are at within their organization and what's the next step that they need to take as well. So again, 5, we're doing great at this. We've done this so many times. We're evaluating it every year. We're improving this process. We know exactly what you're talking about. 1, I never heard this ever. This is great that you're mentioning it. I'll take it to my direct report. And then 3 is saying, we do some of these things, but it's just not effective. Any questions with the tallying and the score? Pretty straightforward? Yeah. Oh, did you have a question? Oh, you were just yawning? Okay, first one. And if you can go into small groups really quickly, whether it's getting up or turning around or whatever you have to do. In your groups really quickly, if you can, I'll give you a couple minutes. If you can say your name and your small group, kind of the organization that you're at, and how long have you been in that organization. I'll give about 5 minutes for that, for intros. All right, we're gonna go ahead and get started. Again, don't be, I don't wanna use that word. Don't be shy about if your organization has not done any DI work at all, but we're here to learn from one another and to find out what each other are also doing in those initiatives, maybe where leadership or committees are getting stuck at, and where other organizations are doing really well in. So the first question to you that you could rank, 5 being, I have great leadership buy-in, our CEO, our board has led in this work, and not necessarily that they're experts in this field, but they are competent leaders in leading the organization well. They know how to lead diverse teams well, they know how to read a room, they have high emotional intelligence, and with leadership buy-in, there has been a commitment to diversity, equity, and inclusion. What can include the 2020 statements? There were a lot of organizations that CEOs wrote a lot of statements to make a stance on DEI. However, what I'm asking is there written commitment anywhere? Has there been a charge letter to your organization? Also, does the leadership and your leadership understand why this is important? Or is there a convincing that needs to happen, which I'm very much aware of, that sometimes we need to convince or we need to coach leadership to understand why DEI is important. And then they may not know exactly what to say or the perfect words to say, but at least they have a sense of why it's important and are able to communicate that. So if you can rank it from 5, our leadership is leading in this very, very well, don't really need to do much coaching, they got it. 1, haven't really heard about their commitment. I'm actually unsure about where they stand with DEI. So if you can go to your groups and rank 5 through 1. If you have any questions, please raise your hands. We're gonna wrap up this section. We have about 3 other more sections. Can anyone share from this side of the room any commonalities of what they found in their groups or any scores without? Yes. And I feel like that's a great point because there's a common theme with boards is that highly educated, highly networked individuals, and so grappling with DEI, but creating a safe space so that they could do that. Because I want to be honest, and we can be real, is that there is a fear there, that there's a fear of either, things shifting too much out of one's control, culture shifting out of what they recognize or what they're used to. And so being able to speak to that fear is very, very important. And that's something that all levels of organization need that safe space to engage at that level. So that if you know anything about organizational change, the change or the shift is only as good as we walk people through that. And I'm not necessarily that that's your role, but what I'm saying is that provide resources around your CEO, around your executive director, around your board, so that we ensure that when the change does happen, it is sustainable. And it's not burden on you all sitting here, you're in the workshop, you already know what it is. But for those who are not aware, to surround them with the resources and the competencies that they need. That's such a good point. That's such a good point. And to your point about lack of representation, it's difficult to work your way up in any type of organization if you don't see yourself at the top. Very difficult. Anyone else from this middle section? Any findings or commonalities?
I guess my point would be as far as leadership buy-in, as I look at it, our board is diverse, but we need to be able to catch kind of the vision of why this is important. Our CEO works more out of a, I would call kind of what we're dealing with, more of a fear and maybe lack of vision. Why is this important? I'm after the nuts and bolts.
Yep.
I just want to get the job done. They'll talk to me about this.
Yep.
I've got other things to do. And sometimes, when you're dealing with this, when the first comment is, I just want somebody who's qualified.
Yeah.
Then you've kind of,
Yeah.
the conversation's going to be more difficult.
Yep.
From that point of view, because you're talking about diversity, and they just want to just talk about status quo.
Yeah.
Anyway,
Yeah. That's real. We've heard that in the many focus groups we've conducted, and it doesn't get any easier to hear as a person of color. When we talk about diversity, and the first thing that comes out is quality. We have very qualified doctors and physicians of color. They're there. Thank you for sharing that and being transparent. This side. Any commonalities?
We don't have, I'm the only one who's actually been in their spot for a while. There, so I have most to say.
Okay.
Yeah, our organization, we're working hard. Again, we leverage you guys to help us through some stuff. And so we've had a lot of conversations quarterly. We survey our team members to get feedback.
Nice.
And we've got annual KPIs of things we're trying to achieve. And it's all out there. Everyone knows. We have open conversations, about why we do what we do and why we're not able to do what we can do, and just get feedback just on that kind of point. It's like, hey, how do you want us to go about hiring in some of these scenarios if we can't find a candidate? They're like, well, no, we want the organization to be successful. We want the best candidate. This is our target is for diversity, but if we can't find someone, we're okay with that. We just want to know that we're trying to do that. And so, it's always a work in progress.
Yes.
There's always questions. There's always challenges. And, in my capacity as CEO, I'm just open and want to have feedback.
Yeah, that's awesome.
Empower people to make decisions. Other thing, with our strategic planning, we have strategic planning groups.
Yep.
And so every single team member's on a group, and so everyone has a voice how we can record our strategies.
I love that.
Everyone's involved.
That's awesome. And as a CEO, I'm so grateful that you're in the room because it shows your leadership buy-in for sure. So thank you. Thank you for that. Next up, 5 through 1. Again, 5, we're doing a great job at collecting key information, so data, whether it's in a form of a survey, whether you're trying to measure your visit time or your hospital visit time, whatever data that you need to get better in terms of DEI, you're gathering that key information. Examples. Is there research supporting the decision in moving forward with this initiative? So how's your organization, have they done research to be able to say, this is why DEI is important in this community, in this city? Do you have a needs assessment? Do you have was there a demographic survey conducted so that your facility is able to say, we have this amount of indigenous peoples, First Nations, we have this amount of Latinos, Hispanics, we have this amount of African immigrants. This is how we want to represent our organization. And also knowing those needs. Has there been key buy-in as well as an assessment? So an organizational assessment has been conducted. What you know as a financial audit, there also can be a DEI audit as well. And have those been conducted at the same time? Were focus groups conducted and were surveys administered? So ranking from 5, we check all those boxes, we're doing this and more, and we're evaluating it every year. Or 1, nah, we're not even touching this. So please disperse in your groups to be able to discuss where you are in terms of 5 through 1. Okay, all right, I want to hear some good stuff. Starting with this side again, any commonalities with gathering key information? Gathering key information for your organization. Is anyone doing it really, really well, or is anyone like, Or just common themes in your group?
I think we've kind of beyond just information.
Yeah.
So we talked a lot about where we are, which is that we conducted some research, we have some task force, we have a roadmap to where we want to go. And talking about how we're moving at different paces and
Yep.
kind of what the staff buy-in looks like and what does that mean when it comes to gathering more information.
Yep.
And I called out because she is part of our HR team and that is also
Okay.
and she has been great about having great conversations with staff, especially as it comes to hiring.
Yep. So it's happening. The processes, you're collecting key documents or key information that you need on the staff level. Awesome. And you said that you are also doing a lot of surveys.
Yeah, we do. And what we started out with, just to share with the team, is what I've shared with the members of our group here. So our organization started out with a survey of our leadership, our executive body first. Once we got the results from the way our executive body thought
Yeah.
and how our executive body saw DEI, then we went to our mid-level managers to do the same survey.
Okay.
And then we rolled it out to our providers.
Okay.
And so with our survey, it kind of gave each of us as individuals where we thought we were
Yeah.
and where we actually
Are.
And it gives details as to what work you need to do on an individual basis.
Yep.
And so all of that put together gave us where we think the organization is and where the organization truly is.
Wow.
And so that survey is what we have taken to really now push forth initiatives to really engage and be intentional about what we're doing.
Yep. Has anyone resonate with that you think the organization is at one point, but then you collect some sort of data, whether it's documents or qualitative in the sense of a focus group or a quantitative data, and it's not, you're like, ooh. Either it confirms what you knew, or that's what data does. It confirms what you know to be true, or what the red flags were, and starts connecting the dots for you, or it surprises you in a good way. It could say, oh, we're actually doing better in this than I had thought. Or the other side is, dang, we got some work to do, people. Has anyone resonated with either of those?
I think our problem sometimes is we do a survey and it comes out, everybody says, I don't believe it.
Oh, okay, then there's that too.
You deal with doctors sometimes, and you do a survey, and they tells them that they're not doing this, they're like, would say, well, it's just people filling out the survey.
You know what was interesting?
That's
because
interesting.
Even the one we use, the assessment we use, I mean, to be honest, when I first got my results, because I thought when it came to diversity, equity, and inclusion, I'm like, I'm in HR, I'm the bomb, it's my experience, I know what I'm doing. But to read through the results, because the results are very detailed oriented, and it gives you specifically what you do that is creating this impression that you may have of yourself. And it gives you a worksheet that you go through that you have to actually answer the questions honestly. And once you answer those questions, you really can see, oh my gosh, it's right. I do these things. And so confronting it was a wake-up call for me.
Yeah.
That I couldn't ignore.
Did someone help you through that, or did you?
Yes.
I mean, because to me, that's
Yeah.
the key, is that we've been
No,
able
we had an
to
expert
help
walk us
somebody
through it.
through
Yeah.
what this means. You know, if you're in the bottom 20 percentile or something,
Yeah.
and you're still saying everything's okay.
That's a problem.
Like
That's a big
one-on-one
issue.
feedback about it. Like,
Something not right.
I had a one-on-one session with the person
Yeah.
administering the assessment, and yeah, I had to face.
And in their context, it was specifically the IDI, which is an intercultural diversity inventory that one can take for their own intercultural experience and what they're learning. And I'm assuming that your leadership did it.
Yes.
So they led by example in conducting an assessment in that manner, and you can see very quickly where you are. I mean, even you can take Emotional Intelligence 2.0 and take a test on how emotionally intelligent one is. And if a leader wants to lead people in an emotionally intelligent way, especially in a pastor, faith-based context, I would want to be emotionally intelligent, and I would want to take that exam to see where I'm strong at and where I'm weak at. But it's getting people, that's the thing with guys with this, let's be real. With DEI, there has to be such a posture of learning. It is very difficult to have conversations with individuals who do not want to learn.
Amen. Not even true. Amen.
Well, I guess
Please, please.
even to add to that, I think teaching people to understand what the questions are asking.
Yes.
Because we did it the first time, and people thought that something meant something different. And so that was a lot of the written.
Yes.
We don't know what this was, so this is how we answered it.
Yep.
So we learned, let's go back and retrain.
Yes.
And have conversations so we're on the same page. And as we took it again,
Yep.
you know, it's like, all right, now we're getting better data.
Yes.
And once you do it a couple times, then you can start to trust that data.
100%.
And same thing with even patients. If you're an FQHC, you have to get your patient demographic
Yep.
information. And so, unfortunately, HRSA and how they ask questions kind of leave that African American, Hispanic, biracial person. So a lot of times we have those individuals who don't answer the question. And
Yep.
they just say, not represented.
Wow.
And you get yelled at by the federal government. It's like, well, you got all these people that say they don't know what they are. And it's like,
Because your questions suck. It's so true. Yep.
Clarifying even to the federal government, hey, you need to recognize that you're missing a whole group of people.
Wow.
You know, again, back to that understanding.
Yep.
You got to understand what the questions are asking.
Yep. And that goes back to the terminology. So understanding that the terminology around DEI, especially, and let's be very honest, when people live and grow up in a homogenous environment, this terminology is going to be very new to them. And so again, with the walking people through, and I'm not saying that this is your role, but if it's your role, God bless you, in your organization, but to have the grace to be able to walk people through this and educate them is going to be a high learning curve for some. And it's just something to be honest about. I want to spend the last couple minutes going, and I'm going to give you my QR code. We had a lot to do, but we're going to keep it moving. QR code to be able to either get our tool on how to create a DEI organizational culture within your organization. So being able to walk alongside your organization, and in the PDF, you will be able to see kind of what level you're at and what the next step could possibly be. Again, it's not a cookie cutter approach. You know this if you've had many conversations. But understanding that if you have done leadership buy-in, and if you are collecting data, is there leadership that are making decisions that are advocating for those who do not have a voice? It is mind-boggling that even in your setting as health clinics and in uninsured and unrepresented communities or under-resourced communities, that the grace that we have on the patients in the community is the actual same grace that we need for the staff. We're neglecting those that may have not gone to certain schools, or there's certain barriers to entry. And just because they're in your clinic or in your organization doesn't mean that they have the full access that you may have if you're the majority in your organization. And so understanding that, let's not neglect the staff level in your work and in your clinic. I was hoping to see hopefully more CEOs and leadership having these conversations so that it doesn't have to land on the staff to be able to create organizational change. I want a couple people to share really quickly. The title of this session is it moving too fast or too slow? Can anyone speak to if they're feeling like things are being rushed too quickly in the organization, or it's moving so slow I might pull my hair out or leave? Oh, okay. Yes, ma'am. Yeah, I'm sorry, let me clarify. In terms of, if you look at it like this, diversity and inclusion could be like a hot, trendy word right now, right? But when we're in this room, what I am looking at are change makers in an organization. So how do you create your organization to be more equitable, to have a culture that is of belonging and more inclusive, that no matter what diverse perspective, I can walk into your clinic, and as a woman of color with my background, with my language, my accent, I'm like, oh, this is family. We're good. I can be myself. I don't have to code switch. So it's a different level of belonging, or I can see representation in leadership. So when you look at DEI, anytime you look at it, think of organizational change, because that's what it is. And when you're doing organizational change, you're working with people. Yay. That's the fun part. Yes, ma'am, you had your hand up.
Yeah, I think on the surface, it looks like, so I personally think that my organization's going a little too slow for me. But at the same time, I think if you were looking at my organization from an outside view, you would think on the surface level, I have C-suite level that Black women, like multiple CFOs of Black women, HR directors of Black women.
Yep.
And I also feel like everybody except for the providers look like my patient population. So I think from the outside view, you feel like, it seems like you're making a decent effort. But I think that understanding, like the biggest thing I think that resonates with what you said is that I think that there are times where staff, even me, can treat our patient population different than we're treating our staff when it comes to DEI.
Yep.
Because if you treat your patient population in a certain way, but then don't treat your staff the same way, one, how is that Christ-like? And two, how is that true? How can you truly say that you're doing what you're supposed to? You're doing the work in the way that is given to you.
Wow.
I feel like that's a disconnect that happens in a lot of places where it doesn't, like, if you're not treating your staff member the same way,
Yep.
you're not speaking to them with the same respect you give the patient, is that because of you feel more entitled? You feel like you're higher up than your patient? So you feel you can reach and respect them in a different way than it might be your staff member? On the same level as you, it looks different than you? Things like that, I think.
Wow.
I haven't, like, our organization has not really absorbed yet and appreciated.
Yep. Can anyone name what she's getting at? What is that thing that is, you have the diversity, I look at your website, you have so many people of color, I can't even count, it's great. But when I'm in there, there's something, nope. It's a part of it aspect. It's a part of organizational change. Can anyone take a stab at it? Culture. Culture. Yes. You can say it again, you have diversity.
Diversity without equity and inclusion
Yes, sir. Yes, sir. Yes, sir. The culture. The culture, which can be measured. And that's through the surveys, that's through perception. And even if one may not trust the survey, keep doing it a couple times. Keep getting the same results. And then say, I see a pattern here. I don't think it's coincidence. Can anyone speak to something that's going too fast for them? Whether they're leading or it's going way too fast. Okay.
I can give an example.
Yeah.
Not from my current workplace, but my past. We had a committee that was being led by people of color to kind of champion DEI, and it moved too fast that it went into very unsafe territory where people were using values or things said without creating a culture of listening.
Yeah.
And so it was creating more conflict
Yep.
for people who worked well together previously.
Yep.
It went super values-based too fast.
Yep.
And then it became no one wants to even touch that
Yeah.
part of the organization. And we were incredibly diverse.
Yep.
A lot of people who English is their second language. And so that was really disheartening for a lot of people.
Yep.
Like, that was just too fast.
Too much.
No
Yep.
one was protecting
Yep, and we saw that after 2020, 2021, where a lot of committees or affinity groups or resource groups got together and wanted to expedite a process that you can't really expedite organizational change because it is leadership-based and top-heavy. And so being able to, what happened there is a lack of collaboration. And so when you have one group who's doing like a coup d'etat situation, and they're like, we're gonna turn over the leadership and we're gonna do our thing, it doesn't work. It doesn't work. And so that's why what my hope is that when you all leave is understanding that, and I wanna say this from the best part of my heart, is that sometimes you're called to a place that you don't belong. Sometimes you're called to a place that you don't belong or that you don't fit in or that is just daggone difficult. Like, I know I'm called here, Lord, but why is everything else so hard to be here? So sit in that, and I want you all to leave empowered, saying that there are resources, there are tools to support you in your work. And if you're a person of color in here, you really want to ask yourself, do you want to carry this burden? Or are you really truly passionate about it? Ask yourself that. And if you are a person of majority culture who is white, ask yourself, how can you use your platform and your power to create effective change, but always remain collaborative? Because we can't do this work without collaboration. Real quick, and then I gotta pray. Go ahead.
If I may just add a little caveat to what you were saying. I think a lot of places where we get this wrong and where we get diversity, equity, and inclusion wrong is because a lot of people tend to think that it's a checkbox.
Yeah.
Diversity it's a marathon. It's not a sprint. It's not something that you can pull a task force together and just say, we're gonna put these things in place and diversity is done.
Yep.
Diversity is an everyday walk. It's an everyday process. It should be part of your culture.
Yes.
In that you're always learning, you're always growing. And I think one of the places that we misunderstand about diversity is that we leave out the big bracket of education.
Yes, education.
And that has to be your foundation in
Yep.
order for your process to work.
Yep, and if you're in this place, you should be educating yourself. Like, everyone has the resources to educate themselves. If they need a little help, we could do a little coaching, but I need to work with something. Something. Let me pray us out. God, I thank you so much for who you are. I thank you for the individuals that are in this room. I thank you that they are world changers, God, even in the ministry that they are in. Lord God, I thank you that you have equipped them for such a time as this. And Lord, I pray that you would surround them with tools and resources and just the feeling of empowerment that if you have called them to this work and to be bridges in their organization, God, that you would equip them with words, you would equip them with wisdom, God, you would equip them with the resources resources, Lord Jesus, to be able to create a space that honors and glorifies you, God, and serves not only the patients that you love, but also the staff that you love as well. So I pray, God, for just mercy and for empowerment with this group, that they would leave knowing that they are not alone and that this work can be done and it can be done well. In Jesus' name I pray. Amen. 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 My card's up here too if you ever want to chat. We're good to go as well.